Good morning, and thank you very much for the National Cancer Society for inviting me here and giving a talk on colorectal cancer. Thank you, Dr. Morelli, for a very kind introduction. Now, I'm going to talk to you about colorectal cancer. I know it's not the best of topics on a weekend like this, but nevertheless, I will tell you why it's very important to know about this cancer, because it's exceedingly going to be the #1 cancer in the world, okay, at least for men. Now, before I begin talking about the cancer, let me just take you into the perspective of things. We need to know where exactly the colon is. Okay, so if you look at our digestive tract, if you eat, food will enter the mouth, enter the food passage, enter the stomach, and then the small bowels, and then it will enter the large bowel, also known as the colon, and towards the end of it is where you have the rectum. Okay. And we'll just focus on that, and we'll just enlarge the picture. And this is a picture of how the colon and rectum looks like. Now, it depends on the gender, it depends on the height of the person. If you're a male, if you're a taller person, obviously the bowel, colon could be longer. Okay, but on average it's about 120 to 150 centimeters. Now, if you look at the lowest part of the colon towards the end, that part is called the rectum, and if you focus on that, the rectum is also where you have your muscles that control your continence. If you don't have these muscles, then you won't be able to control, and you'll be rushing to the toilet all the time. All right. Now, cancers can also happen here. Now, this is a picture of an entire colon that has been removed, and if you look at the colon, you have a part which is what we call the ascending colon, which is on the right side near the appendix. You have the transverse colon, and then it goes down to become the descending colon, and then, as I said, towards the end of it, you have the rectum. Now, most cancers happen on the left side, meaning most cancers happen on the rectum and the sigmoid colon, on the left side, right? Now, if you look at the latest Malaysian government statistics, and our Ministry of Health just released the latest statistics for 2012 to 2016 this year, a couple of weeks ago. What you can see here is that colorectal cancer is the #1 cancer among men. And if you look among women, obviously breast cancer is still the most common, but it is becoming increasingly more common in women also. And if you compare the statistics from 2007 and 2011 as compared to the statistics from 2012 to 2016, what you see is that the trend is generally the same, except that you even have more patients developing colorectal cancer. Now, colorectal cancer is a disease that is primarily still among the elderly. So the older you get, the higher the chance of getting this cancer. Having said that, I have exceedingly seen younger and younger patients developing colorectal cancer. The youngest I've seen was a 15-year-old boy who came to my clinic with bleeding, rectal bleeding. Everybody thought it was hemorrhoids. He was in boarding school, or the teachers thought it was hemorrhoids. After 3 times going to the doctor, only then the first doctor actually do a rectal examination and found out that it actually was cancer. So just because you're not old, but because you have bleeding, rectal bleeding, it is worth a trip to the doctor. Just don't brush off the symptoms. Now, in Malaysia, the statistics can be quite scary. 1 in 56 of all men in Malaysia have the risk of developing cancer, and among women it's 1 in 74. Now, obviously there's a gender and there is a racial difference, and in Chinese it is scary because 1 in every 39 Chinese men is at risk of developing colorectal cancer, and 1 in 49 of every Chinese woman. I did not show the statistics of the rest of the races, but this is the most stark, most marked difference. The Chinese generally tend to get colorectal cancer, and we don't have an answer to that. Why? Now, if you read, there are a lot of postulations on why people develop colorectal cancer. Generally eating a lot of fat, a lot of raw meat, red meat, alright, eating less natural foods, eating a lot of processed foods. Okay, you reduce your fiber intake, living an unhealthy lifestyle like taking a lot of alcohol, smoking, obviously. All these contribute to a colorectal cancer. We don't have an answer on exactly what it is that causes it, but generally leading an unhealthy lifestyle contributes to it. Now, if you're talking about colorectal cancer, like any cancer, you're talking about stages, and I have a video here which will show you what are the stages. Now, colorectal cancer usually starts with a small growth called a polyp. Now, with time, if it's small, it's called a stage 1. Now, if it becomes bigger and bigger and bigger, then it actually extends beyond the wall of the colon, becomes stage 2. And you have these blood vessels with lymph nodes that actually follow this tumor. Now, if these lymph nodes are involved, it becomes a stage 3. Now, if the cancer has gone to the liver or the lungs, then it's stage 4 and it's considered an advanced disease. And hopefully, we catch all cancer before they reach stage 4. Now, unfortunately, in Malaysia, because we do not have a screening program, most cancers, at least 2/3 of our cancers, come at stage 3, stage 4. So, we really need to create awareness on detecting this disease earlier rather than later. Now, the theory is that this growth happens, it starts small, right? First, what they do is that it becomes a polyp, but it does not become a cancer in 2 weeks. It becomes, there are a lot of theories behind it. Some say it takes about 4 to 5 years for a polyp to become a cancer. And the aim here is to catch it when it's small. So how would you, now this is a picture of how a colorectal cancer looks like. Okay, this is a fungating mass that you can see. And also here is a picture of the tumor that is causing an obstruction, and you can actually see the narrowing here. Okay. Now, so what are the symptoms of colorectal cancer? Number 1, this is the most subtle symptom: changes in bowel habit. Don't take that for granted. All right. Now, everybody has different bowel habits. Some people go to the toilet more often. Some people go to the toilet once every 2 or 3 days. What is important is you establish what is normal for you. Do not compare it to your wife, or to your siblings, or to your husband. All right, or to your friends. Actually, you must know what is important for you. Now, if there is any change in your bowel habit of more than 2 weeks, I think it's a good idea to go to the doctor. Less than that, well, sometimes you travel, you eat something wrong, you get food poisoning. Obviously, you have diarrhea. Anything more than 2 weeks, please go get yourself checked. If you have rectal bleeding, as I said earlier, please go to the doctor. Don't wait. Alright, it could be a simple hemorrhoid, but it also could be cancer. If you have mucus discharge, you have discharge coming out, you can look at your toilet bowl. It's always a good idea to have a white colored toilet bowl rather than a red colored toilet bowl. It's a bit difficult to see what exactly is inside the toilet bowl. Alright, if you have unexplained weight loss, or if the tumor is very big, then it can cause an obstruction and you'll be bloated, you'll be vomiting. Alright, you won't be passing any motion. This is how it might look like on the X-ray. Okay, or if there are occasions where sometimes the patient comes in very sick. You can present with bowel perforation. The patient will be very sick, abdominal pain, you might have a hole in the colon, okay, or the rectum, and that causes feces and pus in the abdomen. Now, how would you find out whether you have this cancer or not? Well, the easiest test is to go to your GP or your specialist and ask for a stool or called blood test. Now, this test works on the assumption that a small polyp or even a cancer causes a minute amount of bleeding, and the aim is to find that bleeding. It's just like a urine pregnancy test, but it's actually testing your stool for any amount of blood. Now, if it is positive, then you need to do a colonoscopy. Now, colonoscopies are probably is the gold standard of trying to detect colorectal cancers. What it does is it involves putting a scope, the camera, into the anus and all the way into the colon, reaching the appendix. Now, as I this is an illustration of what it's like. So we will put a scope, you enter in the colon, you go all the way to the right side of the appendix, okay, and you might go and just have a peek into the small intestine. And if we find anything like this, if we find a polyp or if we find a growth, we can remove it if it's small, or if it's big, then we'll just take a biopsy. At least we know what it is. And if it's a cancer, then we will treat it accordingly. Right? And if it is a cancer, then it's important to know what stage it is, and patients will generally get a CT scan. Now, how would you treat colorectal cancer? Well, the mainstay of colorectal cancer is surgery, right? And we know that the colon is supplied by a very rich blood supply, and this blood supply and lymph nodes follow this blood supply. So the aim is to remove the colon, the tumor, the part of the colon which has a tumor, together with the lymph nodes and the blood supply. So if you remove the right side of the colon, it's called a right hemicolectomy. If you remove the left side of the colon, it's called a left hemicolectomy. And if you remove part of the rectum, it's called anterior resection. Okay. Now, you're talking about surgeries. There are a lot of types of surgeries there. There is the traditional way, is called the open surgery, where the patient will have a big cut in the abdomen. Okay, this is how it might look like. Recovery is late, it's very painful after surgery, but nevertheless, it removes the cancer. Nowadays, we do keyhole surgery, which is much faster, less, it's called minimally invasive surgery. It causes less pain, less scars for the patient. Generally, what we do is we put little holes into the abdomen, and we will operate and remove the cancer, just like in an open surgery, but with much smaller scars, faster recovery. Now, when we operate the rectum, especially the male rectum, is as small as a Coca-Cola can. And the challenge is to remove the tumor out from here, and it's not as easy as it seems. So that is why there are emerging technologies out there, like robotic surgeries. What robotic surgery does is that it actually helps the surgeon remove the tumor in very tight, small places, especially if you have a very big tumor. It's not easy. Now, the robot exactly doesn't do the surgery by himself. The surgeon actually controls the robot next to the patient, or he could be in another room, or sometimes even in another state of the country. Alright? And sometimes we can do remove the cancers from the anus itself, which is very low down and very small. Now, obviously, if the patient has developed colorectal cancer and it's stage 3 or 4, he needs chemotherapy. There will be another speaker after me who will be talking about that more. And also radiotherapy, which is for rectal cancer. Now, having said that, there is no place in the treatment of any cancers, especially colorectal cancers, for these guys. Alright, so avoid going to the BOWEL, because I have seen patients who have delayed treatment because they want to go and see their sensei or their BOWEL, and they end up coming much later. Alright, now what is the screening recommendations therefore? Now, if you're less than 50, you are at low risk, you don't need any screening unless you have a family member who has colorectal cancer. Now, once you reach the age of 50 and above, you are considered at rich risk, and means that even though you have no symptoms, you need to be screened. You need to undergo a colonoscopy once every 10 years, or if you don't want to do a colonoscopy, do a stool blood test every year. However, if you have a family history, or if you have some symptoms, you've got to get yourself scoped every 5 to 10 years, alright, and as soon as you can. So what is the take-home message that I would like to give in my talk today? Number one is that the incidence of colorectal cancer is high in Malaysia. It is number 1 cancer in men, alright, second in women, and unfortunately, because of the awareness and because of the lack of a national screening program, 2/3 of our colorectal cancers present late. And therefore, we have to be aware, and whenever we see a doctor, we actually would probably ask him to help us, refer us to a consultant, or at least do a stool blood test, because screening actually saves lives. Knowing the symptoms early is important, and once, in the unfortunate event that you do develop cancer, the mainstay of treatment is surgery. Right? So, thank you very much. You can read, you can Google up this article on health tips on telomere. We prepared a pretty good rundown of the disease, and if you have any questions, you can ask us now, or you can contact me, and this is my details. Thank you very much. Now, there is a question here on whether does removing benign polyps before they turn into a precancerous state completely prevents a person from getting colorectal cancer. Well, as I said earlier in my talk, of course. Now, the thing is that we don't know whether a polyp is benign or not, whether it's benign or malignant until you remove it. And if it is a pre-malignant lesion, you will obviously save the patient's life, because if you leave it or you don't detect it, then in 5 to 10 years, this particular polyp could become cancer. So, screening does save lives. Now, will the polyp grow back after removing them? That's the next question. Well, it depends on the kind of polyp. And in the report, whoever removes the polyp, whether it's a surgeon or the gastroenterologist, we have to check on the report on whether the margins are involved. If the margins are involved, then you probably would have to repeat the scope to take a wider margin, repeat the biopsy, or you might even have to remove that part of the colon if the margins are involved, and if the pathology